Hi, my name is Aniketh Kulkarni. I'm a software engineer. I'm 34 years old now. I like to engage in multiple sports activities like cricket, football, badminton, running, swimming. But however, I have ligament laxity. It means that my ligaments are loose. I'm more vulnerable to shoulder dislocation. I got my first shoulder dislocation in the year 2014. Right when I was actually doing swimming, my left shoulder anterior superior labrum got torn. Okay, so after that time, like, it was a lot of pain when it got dislocated. I tried to do a bit of physiotherapy, but it didn't help. So it prevented me from doing any activity. Forget about the sports or something. Even to take a suitcase from the loft, it was difficult for me because the shoulder ball used to come out of the socket. So it was then that I researched and I met multiple doctors, and in 2015, early 2015, I thought of getting surgery done. I got surgery done from another hospital, another doctor. He did a soft tissue repair, which was exactly arthroscopic Banket repair, okay, technically. So though it was good for initial 1 year, they told that I can resume to my normal activities and all. But while playing badminton, it again got torn and it again got dislocated last month, March. So when I was doing pull-ups, right, the ball came out of socket completely. Okay, I got another dislocation. Again, bad news, so I had to do something about it. So this time, one of my friend recommended to Dr. Ragu, okay, because he had a successful surgery with him. So I went to him, and the way doctor explained, it was like really, really good. It made you feel that he cares. He made you feel that he's experienced, and he's a master, because Dr. Raghu looked at my MRI scans, films completely in detail, looked at my report, and he suggested three things. One is that I have heel sacs defect, and he recommended remplissage. Second, letarge, so that it becomes even more stable, and if there are any more tears in the ligament, he would repair that also. So that level of detailing and care from him gave me a lot of confidence. Any question that I had for him, he was very humbly and patiently, he used to explain me, and that day itself I decided that I'll go with him. So two things: his humility and my friend's own experience made me select Dr. Raghu.
So this patient Aniketh came to us with recurrent episodes of shoulder dislocation. Previously has undergone 2 arthroscopy surgeries for his shoulder, but which eventually failed. Probably because he had damages extensively, and probably which was not evaluated adequately, and also specific surgery was not done in pertaining to the shoulder dislocation. So he presented to us and we evaluated him. He was found to have a huge heel sac lesion, which is very common in recurrent shoulder dislocations. So in patients who have this big heel sac lesion, that is, heel sac lesion means in the shoulder joint. Shoulder joint is nothing but it's like a ball and a socket joint. When the dislocation happens, the cushion in the socket gets torn. So that's how the ball doesn't have any support anymore and tends to get dislocated again and again. And also the ball also undergoes damage, wherein there is a dent that develops in the ball, what we call as a heel sac lesion. So Aniketh also had a similar huge heel sac lesion, and also with a bone loss on the socket, which is very common in patients with multiple episodes of shoulder dislocation. So that is the reason why shoulder dislocation should not be neglected, because once there is a bone loss, the management gets changed. So similar way, since Aniketh had previously undergone 2 failed surgeries and continued to have a recurrent dislocation in spite of having 2 surgeries, so we had to evaluate him thoroughly. So he underwent CT scan and MRI, and that gave us the calculation of how much bone loss he has. So according to the percentage of bone loss that he had, the best possible treatment for him was to undergo a complex arthroscopy surgery, what we call as a letarge procedure, where we will take a small portion of the bone in front of his shoulder and transfer it to the socket so that we can increase the bone width, cover up the bone loss. And also one more special surgery was done for him, what we call as a remplissage. In remplissage, the heel sacs defect, which is commonly seen in all shoulder dislocation, we fill it up putting it 2 small clips, which are self-dissolvable clips. So once these 2 procedures are done, the patient's shoulders become stable. Then very next day after the surgery, patient will be discharged home. Of course, they need to be on a shoulder sling for 2 to 3 weeks. Once the strengthening is achieved, which generally takes 3 to 4 months from the surgery, then we will put them back onto sports. Before that, they will undergo what we call as a return to sports rehab. That is to improve the reflexes so that they don't sustain similar injury once they go back to sports. So one message what I would like to tell you that is, shoulder dislocation is very common, especially in people who are involved in overhead sports like swimming, badminton, volleyball, and basketball. All these activities exposes the athletes to sustained shoulder dislocation, which could be due to various reasons like ligament loosening, muscle weakness, and different morphology of the bones. Once patient sustains shoulder dislocation, they should always reach out to a shoulder specialist so that we can evaluate them thoroughly to know how much is the damage that has happened. Not all shoulder dislocations require surgery. The first timers generally are treated with the physiotherapy alone. So with a good physiotherapy rehabilitation program, they can avoid surgery and also they can prevent future dislocations. But patients who have undergone multiple dislocations already, they will be evaluated and they need definitely a type of arthroscopy surgeries. But there are various types of arthroscopy surgery depending on how much damage they have had due to the repeated dislocations. So we will plan the management and we will do a surgery which just best suits them so that they can go back to their pre-level of injury sports and completely normal active lifestyle.
Okay, so I immediately selected within a week, and then he said that he operates at Kauvery Hospital, Marthalli. I said yes to it. So on the day of admission, things were very smooth here at Kauvery as well. The nursing staff is very good. They take a lot of care, and on the day of surgery, Dr. Ragu operated, and post surgery also all the nurses, staff, everybody was coming, taking care, etc. So all in all, so this is my next day after surgery. I'm confident that this time mine will be completely solved, and I would highly recommend Dr. Ragu in the case of any shoulder surgery needs to be done. And Kauvery Hospital also, kudos to them for maintaining such a good quality room, good equipments, and nursing staff are really humble. So in case anyone dislocates their shoulder, so my personal experience and my advice for them is to go see a shoulder specialist doctor immediately.